I'm just gonna knock and then we're gonna do some hand hygiene. And my name's Zoe. I'm gonna be your nurse today. We're just, can you tell me your date of birth and your name?
Cameron Pax, 10/2002.
Perfect. So I'm just gonna close this curtain to provide privacy for us, and we're just gonna do a baseline assessment today. We're gonna assess all of your organ systems, your legs, your strength, your lungs, your heart, your skin, make sure everything's okay. Do you have any questions about that?
Nope.
Okay, I'm just gonna assess the room for safety. There's no tubes or anything we're gonna trip on, nothing like that. And then oh my gosh. I've noticed that your mood's good, you're responding to my questions, you're interactive, you're good there.
Okay.
And then I've checked your vital signs, everything looks good there, your blood pressure's good, your oxygen saturations are good, your heart rate, your respiratory rate, your temperature, everything looks good there. And then, can you tell me if you're having any pain today? Can you rate that on a scale of 1 to 10, with 10 being the worst pain you've ever felt and 0 being no pain at all?
0.
Okay. If she did have pain, we'd go through a Caldera, which is, oh my gosh, I can't. Characteristics, which would be like dull or sharp pain. Onset, which would be when did it come? Does it come and go? Oh, that's not onset. Onset is when did it start. L is location. D is duration, which is if it comes and goes. How long does the pain go? E is exacerbation, which is what makes the pain worse. R is radiation. If she had pain in her ankle, does it go up to her shin? And then the other R is relief, what helps with relief. And then A is accommodation, or A is associated symptoms with what, like if she had nausea with pain in her abdomen or something like that. Okay, now we're just gonna check your pupils. Let me see what I've done with my pen light. Can you tell me what today's date is?
The 17th of September 2024.
Do you know where you are?
The Snow College Hospital.
And can you tell me the President of the United States?
Joe Biden.
Perfect, you're oriented ×3, so that's good. I'm just gonna have you look just straight at me, and I'm just gonna assess your pupils. Perfect. Perfect. Okay, can I have you follow this? Perfect. And then to your nose. And I was just assessing for PERLA, which is pupils are equal, round, reactive to light, and accommodation. Now I'm just gonna feel your head and see if there's any lumps or anything like that. Is that okay?
Yep.
Just gonna make sure there's no abnormal bumps, anything like that. Check your sinuses. I'm gonna check your thyroid as well. Make sure that's not swollen. I don't see any redness, anything like that. And also look inside your ears. Make sure there's no swelling, any fluid coming out. There's both good. I would check your mouth, make sure your teeth are all there, make sure there's no swelling, and then check your nose and make sure there's no swelling or runniness or blood or anything like that. Okay, are you feeling any chest pain today, anything like that? No? Okay, we're just gonna assess your heart, and we're gonna listen to 5 different spots. We're gonna listen to the aortic, the pulmonic, Erb's point, the tricuspid valve, and the mitral valve, and then I'll stop on the last one because it's the loudest place to listen to the heart, and I'm just gonna listen for 1 minute.
Okay.
was just right about 82, and so that's in the normal range of 60 to 100 for an adult. And your rhythm's good, and you've got a strong heartbeat. There's nothing to worry about there. And then you aren't having any chest pain, no. And then I'm just gonna inspect your chest, make sure there's no redness or anything. I'm also gonna check for turgor in your skin real quick. Make sure you're hydrated and make sure your skin has that elasticity in it to refill the blood. Okay, now we're just gonna check your lungs. Have you been having any coughs, anything like that? Any discomfort breathing?
No.
No, okay, I'm just gonna check 3 sides on this side and 3 on this side on the front and the back, so 6
Okay.
different spots. And then I'll have you take a deep breath in with every spot that I move.
Okay.
And then I'll have assess your back as well. Okay, deep breath in. Perfect. Okay, you're good to lay back. I've also noticed with your breathing that there's not any delayed effort, or you aren't taking you're not having a hard time breathing, so your effort and your rhythm's good there. Now I'm just gonna check your abdomen, make sure everything's good there. Do you care if I look to inspect it, make sure everything's okay? Everything looks good there. Okay, I'm just gonna palpate the 4 different quadrants, the right upper, the left upper quadrant, the right lower, and the left lower quadrant. Just gonna feel, make sure there's not any bumps or anything abnormal. Make sure we're good there. And I'm just gonna listen to the 4 different quadrants to make sure there's noise and activity going on there. Perfect, there's noise in every single one, so we're good there. And then I'm gonna ask you about your bowel habits, your bowel movements. Do you have any problems with that? Do you have regular? Everything's normal there?
Normal.
Okay, how about your urinating? Are you having any problems with that? Is that hard to go to the bathroom? Nothing?
I'm good.
Good there too? Okay. Now I'm going to check your skin, make sure there's not any bumps, make sure your temperature's good, make sure you have capillary refill, and make sure there's no weird things out of place.
Okay.
Just going to feel your arms, make sure your temperature's good, your color's good. And I'm just going to check your capillary refill on your fingers, make sure it's less than 3 seconds. Okay, I'm going to check your pulses, make sure they're equal. Perfect. Can I have you squeeze my fingers as well? Perfect. You got strength in your arms, and I'm just going to move down to your legs, okay? Make sure I'm just going to do the same thing. Make sure there's no bumps, anything abnormal. This doesn't hurt or anything, no tenderness, nothing like that, okay? Then I'm just going to fill these pulses, make sure we can about 2/3 the way up. Okay, both of those are equal, no problems there. And I'm going to have you push down on my hands, perfect. Now pull up on them, perfect. And then can I have you stand up and walk right over this way? I'm just going to observe and see if you're unsteady or anything like that. Perfect. Okay, everything looks good there. You aren't having a hard time walking, you're walking straight, we're good. Now I'm just going to see if you have any wounds, anything, if you did have wounds. I noticed you didn't have any when I was looking at your arms and legs. If you did have wounds, I'd assess for if they're red, if they're oozing, if they have any infection, anything coming out of them. And then you don't have a catheter. If you did have a catheter, we would check to see if it's draining properly, if it's what the color of your urine is, make sure everything's okay there, and then ask if you had any pain with that. And then you don't have oxygen, so we don't need to worry about that. And then if you had a drain in your stomach or something like that, we'd watch to see if it's draining properly or if it has a blockage. And then I think that's about all. Can I do anything else for you today? Are you feeling okay? All right. Here's your water and your call light, and we'll see you.